Hi, my name is Noelle Kashmiri, and today I'm going to be going over prenatal education. This is my first video for skills video for Nightingale College. I have my right attire on and I have my badge. First, when we go over education with the mother, we always want to make sure that they're informed about prenatal care. We want to discuss how often the patient will meet with the provider, and during that pregnancy, we want to be able to explain how and what's going to happen at these appointments. We want to be able to discuss and explain to the mother what diagnostic procedures and labs are going to be done. And we want to explain at what point in the pregnancy they're performed. So, for instance, the first month, appointments normally start at 4 weeks, or whenever you find out that you're pregnant, and this can be up to 28 weeks. So, the 2-week appointments start between 28 and 36 weeks, and the weekly appointments are going to be from 36 weeks to delivery. So your first appointment for your pregnancy is normally the longest because they're going to be able to discuss surgical history, family history, medical history, your previous pregnancies, risk factors, your estimated due date. They're going to perform your vital signs, blood pressure, your height, your weight, and your blood, pelvic exam, pap smear, ultrasounds. And depending how far along you are, they will be doing either a transvaginal ultrasound or abdominal ultrasound. It just depends how far along you are. And then after this, your monthly appointments will be doing routine appointments. So this is going to be including your blood pressure, your urine analysis, your weight. And then for your monthly appointment, your group of monthly appointments, these are going to be starting at 10 weeks. So for instance, a Doppler, it's going to assess the fetal heart. And then the fundal height, it's going to be for your baby's growth. They're going to check how well your baby's growing. And then at 20 weeks, the fetal anatomy scan. And that typically you can see the gender of your baby. For 28 to 36 weeks, for that week appointment, you're going to be encouraged to get the Tdap vaccine. And if you are Rh negative mother, you're gonna get a Rogan injection at 28 weeks, and then you will have a glucose tolerance 1-hour tests. And then at 36 weeks until delivery, you'll do the same routine things, but on top of that, they're gonna be able to now assess the baby's position, assess your cervix. They're going to do some swabbing. They're going to educate you on contractions and what is false labor, warning signs, and what to do if your water breaks. So just to reiterate what we went over, the initial week that you go in for your baby, whenever you find out you're pregnant, they're going to do an ultrasound to confirm that. 20 weeks is going to be your second ultrasound. Certain pregnancies also, you need to keep in mind, they could require 3 to 4 ultrasounds, just depending. So first trimester, you're going to have urine analysis with a pap smear. Second trimester, you're going to get the glucose tolerance test. And then the third, you're going to do the swab tests. Certain labs that can be done during your pregnancy, they're going to do your CBC, HCG, RH factor. They're going to test for HIV, your blood type. Also, they have 5 genetic tests. If you choose, and you don't have to do it, but they're going to want to know, like, do you want to be tested for this genetic testing? And if you choose, there's 3 of them, and 3 of them are the blood tests, and 2 tests are going to be for Down syndrome. So blood test, Down syndrome, which I think it's called the NIPT, and the quad test, the AFP, which is for the to check for neural tube defects, and then any genetic abnormalities or genetic abnormalities with the amniocentesis and CBS. So next, we want to be able to educate the mother on proper nutrition for a healthy pregnancy. We want to be able to educate her on what foods and vitamins, also maybe even what supplements to include in to be able to have a well-balanced diet. So we need to remember that during pregnancy, we're going to increase 300 calories per day depending on our pre-pregnancy weight. For instance, the foods we want to eat are, we want to have plenty of vegetables and vitamin A, fruit, potassium, which has vitamin C, dairy, which is potassium, calcium, vitamin A and D, grains for iron and folic acid. We can have protein for beans, nuts, and meat. So we want to make sure that anything you eat is going to be fully cooked. So teaching the mother to make sure that her foods are fully cooked, her vegetables are washed, Water fluid intake can be anywhere between 8 to 10 glasses a day is a great. And vitamins are something we strongly want to encourage the mother to take during her pregnancy and even before. So we want to strongly encourage taking prenatal vitamins, and some prenatal vitamins have appropriate amount of folic acid and some may not. But the recommended dose is 600 micrograms of folic acid per day to lower neural tube defects. We want to take omega-3 for brain development. We want to make sure we're consuming iron for to avoid anemia during pregnancy. That's a huge thing. And calcium and vitamin D. We also want to discuss and teach the mother what type of exercises are okay and what exercises should be avoided during her pregnancy. So, for instance, what is really good low impact sports like walking, yoga, that's great during your pregnancy. Certain things that should be avoided are like contact sports, abdominal exercises. You don't want to be doing crutches and you're pregnant. Weightlifting. You don't want to go be doing weightlifting and you've never weightlifted before. We can understand for pregnant women who have weightlifted all their life and then they become pregnant, that's a different story. Anything that causes harm to the baby, we want to avoid. And we want somewhere between 2.5 hours a week of exercise. All this can be split up. You don't have to do it all in one. Just split it up throughout the week. We want to definitely encourage the mother that a little bit of exercise is better than none. Also, we want to be able to educate the mother on appropriate weight gain. A lot of women can be self-conscious about this. Like, what's the appropriate weight? That's underweight, normal, overweight. And we also want to be able to teach some of our obese patients about BMI. So the optimum weight gain during your pregnancy should be about 25 to 35 pounds throughout your pregnancy. If you're underweight, so that's going to be less than 18.5, you want to recommend to gain between 28 to 40 pounds. If you're normal weight, your BMI is being between 18 and 24, that's when you gain the 25 to 35 pounds. And if you're overweight, your BMI is going to be between 25 and 29, and you only want to gain between 15 and 25 pounds. And if you're obese and you become pregnant, your BMI over 30, and you only want to gain about 11 to 20 pounds. So that's important to educate the mother on that. We also want to educate the mother on certain complaints that can happen during pregnancy, so she's aware of, and discuss certain relief for those complaints. So for instance, nausea and vomiting. These are very common. We always want to keep like small meals and do small snacks throughout the day and avoid any like spicy things. We can use tablets, ginger, to help with the nausea and vomiting. We also have constipation. This is huge. We want to be able to increase our fluid and fiber intake and have adequate exercise so we're not constipated, because this is a big thing during our pregnancy. Next, I want to discuss 3 warning signs in which the patient should immediately be aware of to call the provider. So if you're pregnant and you see any redness or swelling and in one foot or your leg, this could indicate a DVT. So you want to educate the mother to go and get help right away for that. If you're experiencing like persistent headaches, I'm not talking about getting one headache. No, if you're getting persistent headaches happening quite often, this could be a sign, for instance, for women who are pregnant, preeclampsia. You're going to have extremely high blood pressure, during your pregnancy. Also, another one is educate the mother on what to do if she has severe abdominal pain. To not ignore that. That could be a huge sign of placenta eruption. And this is when your placenta has come apart from your uterus. And that is extremely dangerous. You need to see someone right away and educate her on the warning signs and what to expect. And that is my video. Thank you so much.